The discovery of senescent cells, often referred to as zombie cells, has opened a promising new chapter in the understanding and treatment of chronic pain. These cells are so named because they have stopped dividing and lost their original function, yet refuse to die. Instead, they linger in tissues, secreting a cocktail of inflammatory molecules, enzymes, and other cellular debris that can disrupt healthy cell function and contribute to various age-related diseases. For decades, chronic pain has been treated primarily through symptomatic management, painkillers, anti-inflammatories, physical therapy, or more invasive interventions such as surgery. But the possibility of eliminating senescent cells as a means to actually address one of the underlying biological contributors to chronic pain represents a paradigm shift, a root cause approach that may help not just mute the pain, but remove a source of it altogether. Emerging evidence suggests that senescent cells accumulate in tissues over time as a natural consequence of aging, stress, injury, or disease. In moderation, senescence may serve a protective role, preventing damaged cells from becoming cancerous. However, when these cells persist beyond their useful lifespan and begin to build up in tissues like joints, muscles, nerves, or even the brain, they may cause long-term inflammation and tissue degradation. In animal studies, researchers have shown that clearing senescent cells can reduce markers of inflammation, restore tissue function, and even improve mobility, all without the need for conventional pain relief drugs. The implications for chronic pain, particularly in age-related conditions like osteoarthritis, fibromyalgia, or lower back pain, are profound. What makes this avenue especially hopeful is that it opens the door to treatments that do more than suppress symptoms. They may promote tissue rejuvenation and resilience. A new class of drugs known as senolytics has emerged, specifically designed to target and destroy these senescent cells without harming healthy cells. Some of the earliest animal models show remarkable results: reduced joint pain, improved cartilage regeneration, and lower systemic inflammation after just a few doses. Importantly, the relief is not temporary in the way painkillers tend to be. It may last for weeks or months, suggesting that the biological terrain itself is being reset. Another encouraging angle is how senescent cell clearance might interact with neuroinflammation, a key driver of chronic pain syndromes involving nerve hypersensitivity or central sensitization. Zombie cells are known to secrete pro-inflammatory cytokines like IL-6 and TNF-alpha, which can affect the nervous system and amplify pain signals. If senolytics can interrupt this signaling cascade, they might reduce not only peripheral inflammation but also calm down overactive pain circuits in the spinal cord and brain. This offers hope for people suffering from more elusive or systemic types of chronic pain, which are often resistant to standard care. Unlike opioids or corticosteroids, which come with risks of dependency or systemic side effects, senolytic therapies aim to be intermittent and targeted, perhaps used just a few times a year. This could revolutionize how we think about long-term management of pain, especially in an aging population that is increasingly burdened by degenerative and inflammatory disorders. Trials in humans are already underway, with early-phase studies exploring whether these benefits translate from mice to people. While more data is needed before these therapies become widely available, the safety profiles in initial reports are encouraging, and the demand for non-opioid, regenerative treatments has never been greater. Beyond the clinical potential, there is something deeply hopeful in the idea that the body's pain is not always an irreversible sign of decay, but sometimes a signal that there is dysfunction at a cellular level that can be repaired or removed. By harnessing the body's ability to clear out harmful cells and restore equilibrium, senescent cell research points toward a future where chronic pain doesn't have to mean lifelong suffering. Instead of being locked into a downward spiral of symptom management, individuals may have access to interventions that restore health, improve function, and extend quality of life. In the coming years, as senolytic therapies become more refined and accessible, we may see a shift not only in how chronic pain is treated, but in how it is understood. Rather than being an inevitable consequence of aging or injury, pain may increasingly be seen as a modifiable condition, an invitation to repair, to regenerate, and to renew. This is the promise of the senescent cell revolution, not just to silence pain, but to rewrite its biological script.